Record number of daily cases. The leaders of Michigan's largest hospitals now, they're speaking out.
They held a joint news conference today, hoping the public will take the steps needed to slow the spread.
News 8's Joe LaFurgey has more on the healthcare call to arms.
That we are squarely in the midst of a public health crisis.
And unlike the spring, when the worst of the state's COVID crisis was centered in southeast Michigan, this time around, it's everywhere, from Detroit.
In the last 14 days, our COVID admissions have risen by 128%.
To Grand Rapids.
We do about 4,000 tests a day, and it's about 15% positivity rate. Just 2 months ago, in September, it was at 3%.
Even up north.
We have seen our percent positivity rate almost triple over the last 4 weeks.
Hospitals are at capacity, and while they have contingency plans, the number of beds isn't the biggest concern. It's who will be at those bedsides taking care of patients. Nurses, doctors, and other healthcare workers are also being hit with the virus.
We want to make sure we're keeping them healthy as we go through this, because it may not be access to a facility need, it may actually be staffing.
Another issue, a shortage of testing supplies, especially for the so-called rapid test, which produces results in hours instead of several days, like the standard COVID-19 test results.
What I'd like to see is even faster turnaround times so that people get those results in less than a day or two.
Our situation in Michigan is once again headed to a place that is going to be very painful for our state unless we take personal responsibility.
And therein lies the problem. We're not listening to the science of controlling the virus, according to the CEOs. Washing hands, wearing a mask, and avoiding even small gatherings.
And we need to get to a place culturally here in Michigan where people understand the science and believe in the science that masking and social distancing works.
Without that cultural shift, the CEOs say things will get much worse. Joe LaFurgey, News 8.